here's our last video for chapter 10. We're going to start off with surgical terms. Again, they have them broken down into cardiovascular, lymphatic, and blood systems. These are surgical terms. Obviously, you're not going to have any blood terms that are related to surgery. Not built from word parts. You can see there's a variety of things. Coronary artery bypass graft. We're going to talk about that in just a minute. And we're going to also talk about angioplasty. Okay, so a bypass, when a person has coronary artery bypass, you heard of somebody say they had a double bypass or a triple bypass or whatever. Okay, so what a bypass is that they take a portion of a vein from the leg that's still healthy and they're going to transplant it up in here, up in the heart. Notice this area right here, between here and here. That area it's got a blockage right here, so the blood can't flow through there. So you see how this whole portion has died and atrophied. What they're going to do is they're going to bypass that area. So they attach that healthy vein from the leg here and they connect it up to the aorta, no longer requiring that this part flow through here. And then after a while it's just going to atrophy and nothing's going to happen at that point. So this would be a single bypass. If a person has a double bypass, that would mean that there's more than one. That would mean there are two blockages. A triple bypass 3 and a quadruple bypass, that's someone who's had 4 blockages all repaired at the same time. A stent, a coronary stent, is where they go in and say a person is having chest pains and they don't need a bypass, but they do need an area has been closed off because of plaque formation in the vessel. What they do is they go in and they put like a little spring in there and then they open it up, and what it does is it causes all of this plaque or buildup to push towards the walls, making a much wider opening for the blood to flow. They remove the catheter part and they leave this mesh spring basically in place. A defibrillator, a person, that's going to be a pacemaker, a person whose heartbeat doesn't stay in rhythm enough will have a pacemaker placed into their chest. Periodically, the battery does wear out and it'll make a beeping sound, a soft beep, and a person who needs their pacemaker battery replaced will know to go to see their doctor as soon as they start hearing the beep. A couple of terms about the blood system. The most common one is going to be a bone marrow aspiration, where a pathologist or a surgeon will go in through this iliac crest of the bone and actually go in and draw out some of this marrow, which is real rich in what they call precursor cells, and that's going to give them an idea of what's going on in the bloodstream. A lot of times it's used to diagnose leukemias. I think that's all we're going to do on this part. Always know your abbreviations, and I think that's all we're going to talk about here. Again, remember, anytime it's built from word parts, you should be able to determine those. And then the not built from word parts, things like cardiopulmonary resuscitation, CPR. I think I told you on the list exactly which one of these to know on the assignment where it tells you everything to do for the chapter. I'll make sure I include a list of those terms that you need. And the last thing are abbreviations. Be sure you know your abbreviations. As always, do all of the exercises I've assigned, as it's not just a futile time waster. It's a chance for you to use those exercises, make flashcards. That's going to tell you the types of things that are important for each chapter. Good luck.